CURB-65 is a clinical scoring system used to assess the severity of pneumonia in adult patients and guide treatment decisions. It's quick, easy, and based on 5 key factors. Each factor earns 1 point, leading to a maximum score of 5. But remember, before using CURB-65, pneumonia must first be diagnosed through a patient's history, physical examination, and confirmation with imaging such as a chest X-ray. Let's go over what CURB-65 stands for. The letter C stands for confusion, indicated by an abbreviated mental test score of 8 or less, or new disorientation in person, place, or time. The letter U stands for urea levels, specifically a blood urea nitrogen greater than 7 millimoles per liter or 20 milligrams per deciliter. The letter R represents an increased respiratory rate, defined as 30 breaths per minute or more. The letter B stands for low blood pressure, that is, a systolic blood pressure of less than 90 millimeters of mercury, or a diastolic blood pressure of 60 millimeters or less. Finally, the number 65 represents an age of 65 years or older. For each of these criteria that a patient meets, they score 1 point. The total score helps determine the severity of pneumonia and what treatment might be necessary. If a patient has a total score of 0 to 1, the pneumonia is mild, and the patient can likely be managed as an outpatient with oral antibiotics. If a patient has a total score of 2, this indicates moderate severity. Hospitalization might be necessary, and treatment with intravenous antibiotics is often recommended. If a patient has a total score of 3 to 5, this reflects severe pneumonia. The patient usually requires hospitalization, and if the score is 4 or 5, ICU admission should be considered due to the high risk of mortality. Each point increase in the CURB-65 score correlates with an increased risk of mortality, so it's crucial to take these scores seriously. Let's apply what we've learned to a clinical case scenario. Patient X comes to the OPD with a productive cough and fever. After taking a thorough history and conducting a physical exam, the doctor orders blood tests and a chest X-ray, which confirm that the patient has pneumonia. The doctor then uses the CURB-65 score to assess the severity and risk of mortality, guiding the decision for the most appropriate treatment plan. For instance, if patient X has a CURB-65 score of 2, the doctor may admit the patient to the hospital for close monitoring and intravenous antibiotics. However, if the score is 0 or 1, patient X might be sent home with a prescription for oral antibiotics and advised to return if their condition doesn't improve. CURB-65 is a simple yet powerful tool that helps clinicians make informed decisions. By quickly identifying the severity of the infection, healthcare providers can tailor their approach to each patient, ensuring they receive the best care possible.